Pediatric surgeries are once again ramping up at children's hospitals across Ontario after hundreds were cancelled during the massive wave of ER visits over the fall. But the chief of pediatric surgery here in Hamilton tells me the crisis is far from over. Surgery levels are nowhere close to normal. He says staffing shortages and a lack of hospital beds are the big barriers in clearing the backlog.
So where we normally might try and do maybe 5 ICU cases a week, we're probably doing maybe 2 or so.
Between surgeries, Dr. Devin Peterson was able to give CityNews 10 minutes of his time to discuss the current situation.
Right now, we don't have enough pediatric anesthetists. We don't have enough nurses in the OR, in the recovery rooms, up on the wards, in the ICUs.
When you say you need more staff, how many more staff do you need to ramp up those surgeries?
It would take dozens of nursing staff. It would take a number of anesthetists, pediatric anesthetists for short. You know, I couldn't quote the number of that, but I bet you it's probably in the vicinity of at least 5 to 10 more.
Right now, McMaster Children's Hospital has about 2,300 kids on their surgical wait list for things like cleft lip operations, tonsillectomies, and spinal surgeries.
There's developmental issues with some of these children. There's pain issues. Some of the kids aren't going to school. We do know that kids waiting longer for surgery have worse results, and long term, there can be a lot of issues.
While surgical capacity here is back to about 60%, Dr. Peterson says they need to ramp up to at least 120% to start clearing the backlog.
Where things stand right now, like you said, we're not out of the woods. There are still children who won't be getting their surgeries anytime soon.
Yeah, we're in trouble.
The province tells CityNews the Minister of Health has been in constant communication with pediatric hospital CEOs and has offered the government's full support to do what's needed to ramp up capacity by making permanent investments to increase critical care beds, capacity planning, and other supports. Over the last few months, the government has added about 18 more pediatric ICU beds to the system, bringing the total to 30. In December, McMaster received permanent funding for 2 existing Level 3 intensive care unit beds and 4 Level 2 ICU beds, which were already in operation.
I don't know how, if we're not even up to normal yet, how do you go to the next level without significant infrastructure, which means nursing, means even more beds we have now, and really sort of trying to kickstart this catch up.
Ontario-wide, close to 12,000 kids are on the surgical wait list, with about 6,000 already waiting longer than clinically recommended. Dr. Peterson says any spike in hospital admissions would shut down surgeries once again and add to the backlog. In Hamilton, Shauna Hunt, City News.